All right, let's jump right in. We're talking about endocrine disorders today, and to really get a handle on them, we're going to look at your body in a pretty cool new way. Think of it like a finely tuned orchestra.
You ever have those days where you just feel off? You're not really sick, but something's just not clicking? Well, that feeling could be coming from deep inside, from your body's most complex communication network. It's this incredible system that works, believe it or not, just like an orchestra, sending out chemical music to keep everything perfectly in sync.
So here's what we're going to cover. First, we'll meet the musicians in this orchestra. Then, we'll dig into what happens when that music is too loud or maybe way too soft. We'll even follow the hormone detectives who figure out what's wrong, see how they get things back in balance, and finally, we'll look at how this whole symphony naturally changes as we get older.
Okay, so first things first, let's talk about the basics. What exactly is this command center we're dealing with?
So, the endocrine system, it's this amazing network of glands all throughout your body. And what these glands do is create and release hormones. Think of hormones as like tiny chemical messengers. They zip through your bloodstream telling different parts of your body what to do. And I mean everything from how much energy you have to how you grow, even your mood.
And this is where that whole orchestra idea just clicks, right? The glands, we're talking about your thyroid, your adrenals, your pancreas. Those are the musicians. The hormones they release, that's the music, these little chemical melodies that run the whole show. And every great orchestra needs a conductor, right? Well, in your body, that's the pituitary gland. It's this tiny master gland in your brain making sure every single musician plays on cue, keeping the whole thing in perfect harmony. But what happens when that beautiful harmony gets totally thrown off?
Well, when it comes to the endocrine system, almost every problem boils down to one of two things. Either the music is playing way too loud, or it's barely a whisper.
The official names for these are hyperfunction and hypofunction. Hyper means too much. Your glands are overproducing hormones. The orchestra is just blasting away way too loud. Hypo is the opposite, underproduction. The orchestra is playing so softly you can barely hear it. And either way, the whole body gets thrown completely out of whack.
So, why would the music suddenly get deafeningly loud? Well, there are a few reasons. Maybe the conductor, that pituitary gland, is just pushing one of the musicians way too hard. Or a tumor could pop up on the gland itself, basically causing it to go rogue and just pump out hormones nonstop. And here's a really wild one. Something called ectopic production. This is where cancers in totally different parts of the body start making hormones they have no business making. And sometimes it's your own immune system getting confused. It can create these antibodies that act like a stimulant, basically forcing a gland to overproduce, which is what happens in Graves' disease with the thyroid.
Okay, so what about the other side of the coin? Why would the music be too quiet? Well, again, the conductor might just not be giving the signal. Or the gland itself could be damaged, maybe from an infection or toxins or even an autoimmune attack where the body attacks itself. It could also be a genetic thing, a problem baked into the system. Or get this, sometimes the body makes the hormone just fine, but it can't flip that final switch to make it active. No matter the cause, the end result is the same. There's just not enough music to tell the body what to do.
So, you've got a problem. But which one is it? Too loud? Too quiet? Why? Figuring this out is, well, it's not always easy. It takes some serious detective work.
And this quote really nails the problem. The symptoms, they can be super vague. We're talking about things like feeling tired all the time or unexplained weight changes. And they don't just hit you overnight. They creep up so slowly that it can take months, sometimes even years, to finally figure out what's going on. So, how do the hormone detectives actually solve the case? Well, it usually starts with just looking at those vague clues, the symptoms. But then comes the really crucial step, biochemical measurement. They'll actually test your blood, urine, or saliva to measure the hormone levels, to see if the music is literally too loud or too soft. And if that's still not clear, they might do something called dynamic testing. You can think of it like a stress test for your glands. They'll either poke a gland to see if it can ramp up production, or they'll try to tell it to quiet down. It's all about seeing how the system responds under pressure. All right, so the detectives have cracked the case. Now what? The next step, of course, is to get that orchestra back in tune. And the way they do it is actually guided by a really clear, simple logic.
And it really boils down to these two paths. The logic is just beautifully simple. If your problem is hypofunction, not enough hormone, well, you replace what's missing. Easy enough. And if it's hyperfunction, way too much hormone, the goal is to shut down that extra production.
So how exactly do you turn down the volume on an overactive gland? Well, you've got a few tools in the toolbox.
There are medications that can literally block the factory from producing the hormone. You can use radiation to shrink a gland or a tumor that's causing the problem. Sometimes you have to go in with surgery and just remove the source of the issue. And then there's this really clever approach using drugs called receptor antagonists. They don't stop the hormone from being made, but they basically put earplugs on the body's cells so they can't hear the message. Pretty smart, right?
Okay, but it's important to remember that it's not just disorders that can change our hormonal symphony. The music, it naturally shifts and changes over our entire lives, and that's especially true as we get older.
Yeah, as we age, a bunch of the key musicians in our hormonal orchestra just start to play a little more quietly. You can see some of the big ones here, things like DHEA and growth hormone. Melatonin, the one that helps you sleep, that goes down too. And of course, the big sex hormones. Estrogen in women and testosterone in men, their levels tend to decline. But here's the thing, it's not like everything goes down. It's not a universal decline at all. Some hormone levels, like your day-to-day cortisol and your main thyroid hormones, they pretty much hold steady. And what's really interesting is that sometimes insulin levels can actually go up.
And then, believe it or not, there are some hormones that actually increase as we get older. Now, why would that happen? Well, it's often because the body's receptors, the ears on the cells, they just get a little less sensitive. So the glands have to shout louder. They have to produce more hormone just to get the same message across. It's a clear sign that the whole communication system is just having to work a lot harder.
And all of this brings us to a final, really fascinating question. We tend to think of this age-related decline in hormones as, just a bad part of getting older, a failure of aging. But what if it's not? What if it's actually a protective feature? Some scientists are now proposing that this hormonal slowdown is an intentional design, a way to slow down our metabolism, to maybe prolong our lives. It's a really powerful idea that could completely change how we think about the whole process of aging.
So when you think about it, whether we're talking about a disorder that needs fixing or just the natural rhythm of life, understanding your body's orchestra is really the key. It helps you navigate its music for your entire lifetime. Thanks so much for joining me for this explainer.